Hello everyone, I'm Dr. Rosen here with one of my favorite patients, Shoshana. And today I asked Shoshana if it would be okay to do a little interview to explain some of your experiences at my office. So can you tell everyone how you first learned about my office?
Yeah, so I went online. I was looking for a doctor, a chiropractor to go see. Some of my friends recommended that I get adjusted for the pain that I was experiencing.
Right.
So I did a quick Google search and found your webpage and read some great reviews about you, so I decided to call up and make an appointment.
Okay, and I think actually you took advantage of our opportunity to do 2 consultations.
Yes.
And I really felt like you were interviewing me when we sat down, because I
Yes.
think one of the other doctors that you went to before coming here didn't have a good feel with your experience. Is that correct?
Yeah, the previous chiropractor I had gone to, it wasn't a great experience. Wasn't The office was friendly, but I didn't feel very comfortable.
Right.
And I knew walking in here that the minute I saw the office and I met you and your staff, that it was a very friendly and welcoming environment.
Right. So we started shortly thereafter.
Yep.
And I think so. One of the things I like to explain is 20% of the time patients come in with mainly a back problem or a neck problem, and it's only the back or the neck. And then 80% of the time it's the back and the neck and some other health-related concerns, metabolic concerns, and some nutritional stuff. So can you tell a little bit about your experiences besides just the chiropractic that we've tried to give you some assistance with or guidance with for you to improve your health even further?
Yeah, you've gone over some foods that may possibly be triggering the inflammation.
Right.
That do contribute to the pain that I experience. So since meeting with you, I've cut gluten out of my diet.
Good.
I've gotten rid of most sugars, such as like a soda
Right.
is the biggest one, coffees as well.
Right.
So you've really helped me make a change with not just the pain and trying to get over the pain, but my diet as well and some of the things that affect
Right.
the pain that
I
experience.
wouldn't be that much of a stickler though. I'm not like putting a gun to your head to do
No,
that.
no,
Right?
no, no. This was all voluntarily.
Right.
You really showed me the reasons why I should cut those things out of my diet, especially the gluten. That was the biggest challenge at first, but it took a little bit of getting used to, and I've really adjusted, and I can't go back.
Great. So some of the things that I also like to explain is I don't try to get someone here 3 days a week for 21 weeks and then 2 days a week for 20 weeks. And so we've kind of got to the point now where you're more aligned or you're more in tune with your body and when you need to get here versus having can you speak a little bit about that, like knowing when to come versus not me necessarily setting up your schedule, but you calling me when it's time or when you know it's, is that how we've been doing it so far? Or,
Yeah, based on the things that I was experiencing, you recommended things to me, and I did follow your recommendations. Again, every time you've explained something to me, you've always explained the whys behind it.
Right.
So that, as a patient, was really important for me to understand why you were suggesting the things that you were doing.
Right.
So since then, again, like you said, I've kind of figured out how many times I need to come see you, when
Right.
I need to call you. But again, it was all voluntary,
Awesome.
and I've really enjoyed it.
Good. Well, I appreciate you taking the time to do
Thank
this with
you.
me today. And hopefully, if you're suffering with some kind of health concern, then you'll feel the need to call us as well. Thank you so much.